Bryan was extremely determined through his whole life, even from the time he was born. When Bryan was born, he had fetal varicella syndrome and was in the NICU for 4 months. The longer you can put off a lung transplant, the better off you are. What we tried to do is stave off the lung transplantation process.
He developed what's called post-infectious bronchiolitis obliterans, or Sawyer-James syndrome. Very early on, he required a tracheostomy, had repeated respiratory infections that essentially left him with a very limited lung capacity.
I wasn't able to go for long walks, wasn't able to, do most normal people things, and I was tired of being tired.
Bryan came to us, and I really asked him, how much is this respiratory condition impacting you? And he never hesitated. He said, I want to get a double lung transplant. I want to be able to do things that I have always dreamed about and I couldn't. When you see that degree of determination, you know how hard the patient, the family is going to fight to overcome that.
I had 4 dry runs. Number 5 was the actual call. I was on my way home. I was pulling in our neighborhood, and they called me. We were on pins and needles, and
It was a go.
it was a go.
It was a go.
And this was 5, 6 o'clock maybe. I was in surgery by 2 a.m.
In regards to Bryan's condition, we pushed beyond just the normal limits of lung transplantation, being able to offer the advances that other institutions may not be able to do. An example would be the complicated case of Bryan Klemm that we were able to pull through. What is unique about our team is we follow the standards of lung transplantation, but whenever the patients are not following or not falling in this group, we never say no. We always sit down as a group and try to overcome the challenges and think about complex situations and see how we can help the patient. And through this process, we have helped many, many patients that would have otherwise lost the opportunity of having transplant and quality of life procedure.
I feel like other facilities saw me as a statistic. UF Health, they listened to my family, myself. They cared for us like
We were part of the
people.
team. We were part of the
We
team.
felt part of their team.
I think I'm very fortunate to really have the best job possible. Having the ability to transform the lives of patients in such a powerful way, being able to be discharged from the hospital, getting their lives back, and then 1 year, 2 years later, you get pictures of them in their Christmas time or what they were able to achieve, or that they're going back to college. I think it brings a lot of purpose.
Now I'm able to exercise normally. I'm able to breathe better. I'm actually starting to forget what it was like. They legitimately saved my life and could not have asked for a better team.